What is pneumonia? Pneumonia is an infection in the lungs that develops in people who have a viral, bacterial, or fungal infection. Pneumonia in children often begins after they've caught a respiratory virus such as adenovirus, rhinovirus, respiratory syncytial virus, RSV, or parainfluenza virus. Who gets pneumonia? Anyone can get pneumonia. The viruses and bacteria that cause pneumonia are contagious. They spread easily by sneezing, coughing, or contact with contaminated surfaces like shared drinking glasses, used tissues, doorknobs, and faucets. However, getting infected with a virus or bacteria from someone with pneumonia does not necessarily mean that the infection will develop into pneumonia. Children who are more likely to get pneumonia include children with chronic illnesses such as heart or lung disorders, children with asthma, infants born prematurely, children with a compromised immune system. Signs and symptoms. What are the signs and symptoms of pneumonia in kids? Symptoms of pneumonia in infants and children vary depending on the age of the child and what's causing the pneumonia. Kids with bacterial pneumonia usually get sick quickly and have a high fever and rapid breathing. Viral pneumonia symptoms tend to appear more slowly and may be less severe. Wheezing is more common in viral pneumonia. The length of time between when your child is exposed to the germ that causes illness and when they feel sick from pneumonia, called the incubation time, varies. If a child develops pneumonia from a cold caused by RSV, symptoms will start in 4 to 6 days. With the flu virus, symptoms can start after just 18 to 72 hours. Pneumonia caused by bacterial infections can last 1 to 2 weeks with appropriate antibiotics. Because there are no medications to treat viral infections, symptoms from viral pneumonia may last longer. Call your child's doctor if you notice any of these pneumonia symptoms. Cough, fever, rapid breathing. In some cases, this is the only symptom. Breathing with grunting or wheezing sounds. Labored breathing that causes nasal flaring and makes the rib muscles draw in, muscles under the rib cage or between ribs suck inward with each breath. Chest pain, abdominal pain or vomiting. Loss of appetite in older kids or poor feeding in infants, which may lead to dehydration. Seek immediate help if your child is having trouble breathing or is breathing abnormally fast, has a bluish or gray color to the fingernails or lips, has a fever of 102 degrees Fahrenheit 38.9 degrees Celsius or above 100.4 degrees Fahrenheit 38 degrees Celsius in infants under 6 months. Learn how to spot the differences between pneumonia symptoms and symptoms of other respiratory infections. Tests and diagnosis. What tests do we use to diagnose pneumonia? Your child's doctor may order a chest X-ray to diagnose pneumonia. The doctor also might order blood tests, tests for viruses and nasal secretions or bacterial cultures of mucus produced by coughing. Treatment. How do we treat pneumonia children? In most cases, children with bacterial pneumonia receive oral antibiotics at home. If your child's doctor prescribes antibiotics, make sure your child takes all the medicine as directed. Not taking antibiotics according to the directions can make the infection worse or spread it to other members of your family. We can treat pneumonia due to flu virus with antiviral medications to target the flu. These medications are only helpful if you start them within the first 2 or 3 days of symptoms. For other viruses that cause pneumonia, there are no medications. In these cases, supportive measures such as keeping your child hydrated, controlling fever, and treating wheezing or oxygen need help fight off the infection. For wheezing, your child's doctor might recommend using a nebulizer or inhaler. One way to know if your child's lungs are getting enough oxygen is to check their lips and fingernails. They should have a pinkish hue, not bluish or gray. If your child has a cough, ask your child's doctor if any over-the-counter medicines might help. Cough suppressants may not help with cough caused by pneumonia. And non-prescription cough and cold medications are generally not recommended for kids under 6 years old. You should check your child's temperature at least twice a day, morning and evening, while they are sick. In older infants and children, call the doctor if the fever goes above 102 degrees Fahrenheit 38.9 degrees Celsius. For babies younger than 6 months, call if a fever is above 100.4 degrees Fahrenheit 38 degrees Celsius. We may recommend a hospital stay if your child needs supplemental oxygen, has a lung infection that may have spread into their bloodstream, has any chronic illnesses that weaken their immune system, is vomiting so much that they cannot keep down oral medications, is dehydrated,